So here we're with Kimberly Homan, who is director from the Complex In Vitro Systems Lab at Genentech in San Francisco.
Yep.
Thanks for being here. Obviously, you have a very diverse background with like a lot of experience in bioprinting, biotech startups, and you also had a stop at the Wyss Institute, which of course I think a lot of people know. And so you're now at Genentech, and we want actually to start off with knowing what drives your research and what like keeps you motivated and what got you motivated in the first place.
So for me, the motivation has always been about patients and the translational aspect of this research. I've been really interested in it since I was in Wyss, from bioprinting tissues that could be implanted to now using chips for drug research. So yeah, both of those areas excite me. But right now I'm hanging out in the pharma world.
And when you like look back on your work, was it like logically for you, or like, yeah, of course, looking back, was it logically for you that you would kind of end up with an interest in like organ on chip? And when was the point where you realized that this technology would sort of have potential for like for the clinical aspects and also for drug development and drug testing?
I mean, my scientific career has been really varied. So I spent a lot of time, I was originally a chemical engineer, and then spent time being a biomedical engineer and working in the nano field for a long time in imaging and biomedical imaging contrast agents. So it took me a long time to get to this, field. And I got interested in it when I joined the Wyss Institute under the direction of Jennifer Lewis, who is a 3D printing expert and had just moved there from another university. So she was in Harvard, and I was really excited to apply 3D printing to human tissues. So that was just like really enthralling for me. But then since then, I think I've been really trying to hone in on what is the applicability or usability, of this technology. And that's what attracted me to help create this group at Genentech, where we really try to utilize them in our everyday lives to push drugs forward.
I have a follow-up question that, coming from like bioprinting, how relevant do you see this kind of technology still in the organ on chip field? Like, do you think it's something that still has potential or that should be investigated more?
Good question. We have bioprinters in our lab. We have that capability to both print, inert materials and materials that have cells with them. I would say that I'm hoping that the standardization that's coming in the field will make that a little less needed. So hopefully with more and more startup companies being able to standardize and being able to create chips that are more reproducible and things like that, having to do it internally in our own house maybe won't become as needed in the future. I think it will have a place for many novel ideas and concepts in years to come. But I think that at least as far as pharma goes, that slice that needs that will still remain fairly small.
So then something a bit different. So there is an iconic aphorism that I really like from George Box, who said that all models are wrong, but some are useful.
Yeah.
And of course, he was referring this to statistical models,
Right.
but we can equally apply this for organ on chip technology. And so since we're always like striving to improve the models that we use and also to like standardize models. And of course, this is a bit impossible to predict, but what do you think is the next big improvement that we can maybe expect from the field of organ on chips, or what would you hope that it would be?
I'm hoping scale and reproducibility and lowering cost. Because, where I sit, there's a lot of teams that would love to use some of these models, but unfortunately they're, out of reach even sometimes for big pharma companies. So I would love to see that improve so that we as a field can really see these models used with, in the widespread use that they could have if they were more accessible in terms of price.
Yeah. So I mean, that's kind of a nice transfer to the next question.
Yeah.
So what do you think we as an organ on chip field have to do to get more clinicians like on board, or also maybe work together? So whereas like, what can we do from like the lab where we do research to the clinic, to like how should we involve this?
I think that we need to get better at defining our contexts of use, and then ensuring that those contexts of use are covered by your actual model you're developing. So for instance, just saying, that you're going to make a chip that covers all liver tox liabilities is too broad a definition. But one that covers cholestatic injury for small molecules that starts to get more specific into a very specific context for which we can actually feel like the models are interpretable. So I think generally as researchers, moving away from only one proof of concept experiment with one molecule to show why, this model is exciting, and into benchmarking exercises that have tens to hundreds of compounds where we actually can see the predictivity and calculate the sensitivity and specificity of a model, I think that's where you're going to get into better utility.
So also really like disease-specific models. Yeah.
You can do, your context can be very specific to a disease. It could be specific to a specific kind of tox. It could be specific to modality. So you could say, I'm really interested in small molecules or antibody drug conjugates or cell therapies, right? So you kind of have to narrow in on that in order for the model to be interpretable. Because like you said, all models are
wrong.
Right.
Yeah.
And so how can we narrow it so that we can get it right more often is what I'm interested in.
And so, correct me if I'm wrong, but from like the outside, it looks like the US is a bit in advance with this than in Europe, since the adaptation of the FDA modernization. I will repeat this. So, correct me if I'm wrong, but it seems like the US is a bit in advance compared to Europe when it comes to incorporating organ-on-chip models already in like the preclinical phase. So what do you think can the European Union or can Europe learn from the US?
I'm interested why you think that. I mean, I do think the FDA Modernization Act is nice to have, and it brought visibility to this issue. But we already had the ability to incorporate these models well before the act was ever there. So this is a common misconception. It's actually just a wording change, but all of the guidances already allowed us to do this, and we were already doing it before the act.
But do you think that the ruling of the act changed, like this changement of visibility, did this draw like new actors to the stage that were then interested in using organ-on-chip models? Did you observe anything?
Yeah, I think the visibility is great. So the visibility of the act, that was brought by the act, both in funding and in bringing people to the table and engaging more regulators in the conversation, like those are all great things. And, now we see the FDA Modernization Act 3.0 under development. And so that we'll see how that plays out with time. But that might be an actual change to our process. So we'll have to see what it comes out to be.
But hopefully we could correct this misconception that I think not only I was having, but who knows, maybe. And then maybe as a last question, so next to your research achievements, you were also a US Marine Corps veteran. And so what inspired you to go back to research? And also, are there things that you could take away from this experience that now help you in your field or in your daily work?
Yes. So I always had science as a final objective for myself. I think I was super interested in all of the really interesting training and character building that the Marine Corps allows you to do. And most military services, not just the Marine Corps, but I was particularly attracted to all the challenges there, both physical and mental. But what they did the best that I took away is honestly leadership skills. So how to lead people in really complex ways through really hard environments. And I was able to, I hope, bring that to our groups that I've been leading now, both in startup companies and in Genentech. And I think it allows me to bring a perspective on that might be different than other people's, especially on how to take care of others.
I think a very good approach that I think everyone in a managing position should have, actually. So, thanks a lot for taking the time.
Thank you.